Hello, ladies and gentlemen. Thank you for spending your precious time here with us at the Speaker's Corner at IDS 2025. Thank you that you're here in Cologne at the Köln Messe. Yeah, it's 12 o'clock and it's time for the next presentation. So let's look forward to a special highlight here at the IDS 2025. Join the next speaker duo as they have a look into the future. In their inspiring discussion, they will show us how groundbreaking research, innovative technologies, and clinical developments are revolutionizing dentistry, redefining oral health and well-being for people worldwide. That's a big one. So thank you very much for that. And experience now how visions become also reality. So, big round of applause for the president of the American Dental Association, Dr. Brett Kessler. And thank you. And the CEO of ADA Forsyth Institute, Wenyuan Shi, on stage. And we wish you very nice insights and a deep talk with them both. Thank you very much.
Hello, everybody. Thank you for spending your lunchtime with us. Dr. Wenyuan Shi and I are very honored to be here. And it's nice to see some familiar faces in the crowd. And hopefully, if you don't know me or don't know Wen, hopefully you'll get to know who we are, what we stand for throughout this time together. We're going to talk about enhancing global oral health and eliminating diseases. I have nothing to disclose other than I am an employee of the American Dental Association. My finances are paid through ADA. I am not allied with any other companies or partnerships with any other entities.
And I don't have any financial disclosure on this either. And very good.
And so, being part of the American Dental Association and having this opportunity to lead them has been quite an honor. The ADA, we have 159,000 members in America, and we've got a global presence of international membership as well. And we are the biggest lever in the profession in our country. And if we are to be thought leaders, we must provide a thought. And so that's what we're doing today. Okay, so I started out a little bit of my history is I did a general practice residency after dental school, basically working in a hospital. And the practice that I was in was obviously I was a resident, but my boss was the dentist to the stars of Chicago. And we had people in our practice that were high profile celebrities, sports celebrities, multimedia celebrities, and all he did all day long was full mouth reconstructions on the A-list of Chicago. As a resident, I did a little bit of that. I was the dentist to the Chicago Cubs, and I did some dental work on some prominent people. But after I learned about technical dentistry and comprehensive dentistry, and it was very enlightening to me. And after that, I moved to Michigan, which is one state over from Chicago, from Illinois, and I joined a practice in an economically challenged place. But I was able to do the same kind of dentistry that I was doing in Chicago on United Auto Workers, and it was really fascinating to me. Okay. I'll come back to my story in a little bit, but we published several papers that are impactful, we think, to looking at the future of oral health. One was with the World Health Organization, and then also NIH is talking about the future of oral health, and it's evolving right in front of our eyes. Okay, and in some of these reports, oral diseases accounts for over 3.5 billion people annually are suffering from it. Okay, the burden exceeds the combined burden of the next 5 most prevalent non-communicable diseases. Okay, it's really a problem across the world. Okay, it creates $710 billion in our economy because of poor oral health, and the connections between oral and systemic diseases are so evident that we have to take it seriously. And so we as the ADA, our vision, we talk about empowering the dental profession to achieve optimal health for all Note it doesn't say optimal oral health for all, it says optimal health. We know the impact of improving oral health will improve systemic health and overall health for our patients we serve. And our mission at the ADA is to help our dentists succeed, help our members succeed, while we're improving the communities that we're serving. And the bottom line is we make people healthy. Okay? So, the mouth is connected to the body, and I learned that in my general practice residency, and it was solidified there. But when I got out of my residency and into private practice, the systems that pay us disconnect the mouth from the body. And so we've got some serious barriers to overcome in our country, that some countries have this figured out, some don't, okay? But in our country, why has it become culturally accepted that I can get a titanium post right here if I had degenerative joint disease, but I can't get one here if I'm missing a tooth? Why is it that medicine has been afforded the opportunity to provide its absolute finest care to any of their patients, no matter what kind of benefit system they have? Whether it's Medicaid, and in our country, Medicaid is insurance for poor people, Medicare, insurance for old people, private insurance, no matter what, medicine is afforded the opportunity to provide its finest care to their patients, and we're not. Okay, but is it essential? And so if we were to translate the dental benefit model to medicine, if you were missing a tooth, we would give you a flipper. But if you had degenerative joint disease of your hip, we'd give you crutches, because that's what a flipper is. It's not definitive. It's crutches. Why have we allowed this to occur? Okay, and so the question occurs, like, what is the minimum standard for oral health? We don't have that defined yet. It's been culturally accepted that we can put a flipper in, but medicine could put a definitive treatment. Okay? So is dentistry essential? In America, when COVID hit, our government came to us and said, hey, dentistry, you need to shut down. We need to, quote unquote, lower the curve, because our hospital system could not meet the demand of potential people who needed to be on respirators. And all they knew about the virus was that it spread through aerosols. And what do? We create aerosols. So the fear was that we were going to increase the amount of COVID exposures and then hurt the demand in the hospitals. And so we said, wait a minute, government, we need to stay open, because dental disease is going to progress regardless of what kind of virus is out there, and we need to be available to our patients. So they said, no, just go to the ER, the patients will go to the ER and it'll be okay. But if you remember at that time, in America at least, if you thought you had COVID, they said, come to the ER, and they would tell you, don't get out of your car though, open your window this much. Someone with a spacesuit will come out, and they'll have this long Q-tip, and they'll put it through that little window crack and put it through your nose, go like this, come back out, and they're wearing spacesuits and we're wearing scrubs. We didn't know what an N95 mask was in dentistry at the time. Some of us did who worked in a hospital, but for the most part, they weren't available, and we didn't know what they were for or whatever. Okay, so and the process that nobody wanted to go to the hospital for anything, and most hospitals didn't have definitive dental care available for their patients. We fought to stay open, and when we fought to stay open, we declared ourselves essential care. We knew what our role was in the delivery of medical chain, and we did our job, and we stayed open, and we were very successful. Less than 3% of transmissions of COVID happened in the dental office. If you worked in a hospital in any way, shape, or form, 35% of you caught COVID, whether you were a physician, a nurse, an administrator, a janitor, lab tech, whatever, 35% of you got COVID. The dentistry industry knows how to manage infection control, and we did it very successfully. So as we declared ourselves essential, what does that mean? Okay, that means that there's a base minimum of care that we should be providing. Okay, and if we are declared essential, we can then reform the insurance industry, which is horrible in our country. Okay, we can expand coverage to those who don't have it. The cool thing about America is that we're treating 175 million patients every year. The problem is there's 175 million of our citizens that don't access it. We're only accounting for 50% of our population. And to me, that's a professional failure. Okay? And then we need to walk the walk with the mouth-body connection because, again, it is connected. And I learned that in my general practice residency. And so in order to do this, our benefit system isn't working. So we have to reinvent how we get paid, because ultimately we have to have a business plan for our businesses so we can provide the care that we provide. Currently, right now, we only get paid if our drill is spinning or if we're scraping something. We don't get paid for consultative services. We don't get paid for motivational interviewing. We don't get paid for oral hygiene instruction. We don't get paid for tobacco cessation discussions, nutrition discussions, stress management. Medicine does. Essential care allows for that to happen. So we need to expand our paradigm of what actually we can get paid for based on the efforts that we're doing and the impact that we're making. Back early in my career, Pete Dawson was a big mentor of mine, and he challenged us to become physicians of the masticatory system. He challenged us to look beyond just the teeth. He would call people who would just drill holes and fill holes tooth carpenters. But look at all the systems. Look at the teeth. Look at the gums. Look at the bone. Look at the muscles. Where's the jaw seated? All of these things in a holistic fashion. And I remember him saying this to me. He's like, Brett, if you just equilibrate everybody's bite, all their problems in their life will go away. And, your marriage will get better, your life, all these things. And, we know it was a little exaggerated, but that's how deeply he felt about it. And we did, I did a ton of equilibrations, ton of balancing the bite. I did a lot of facial pain in my practices. And, but about 25% of our patients didn't get better. And so we started looking deeper into the other systems and hey, there's an airway issue. And we learned that compromised airways lead to more parafunction and lead to more problems. And we as dentists have this great opportunity to be a screener of airways because we're looking in the mouth all the time. And the cool thing about it in America is that we found a way to get paid for it. Therefore, it started to explode in our practices. So that was our first foray into medical dental integration because we were providing a service, a life-saving service for our patients that expanded out of dental benefits. And we were improving the health of our patients. I'm going to move on. So our vision, as I said before, is to improve the overall health of our patients, of our communities. But in our country, we're still having challenges with what it means to be essential. Because we were essential in COVID, but now that we're out of COVID, it's, with that essentialism, there's responsibility. We can't be conveniently essential. We have to be essentially essential. And that's where we can really play a part in helping out with the primary care shortage of doctors, and we can do a lot of the screenings and get these patients to the doctor. They're physicians. We are doctors too, I guess, right? Okay. So if we can change the system to not only get paid for the services we're providing with our drill spinning or our scraping, but what if we can improve the patient's lives and we have markers that can show that periodontal management can help improve diabetes management. We can do these markers. Right now we have them in kids, but we need to develop them in adults. And so because the mouth is attached to the body, we now have this opportunity as essential caregivers, essential health, in the essential health chain of being that first screen. Patients still come to us in a preventative mindset. Most don't go to their physicians for prevention. They go to their physicians when something's wrong. And so when they're coming for a checkup, they're coming for a prophylaxis, they're coming for the radiographs, that's prevention. And we have this opportunity to share our thoughts and our recommendations and do screenings and get paid for it and improve the overall health of our patients. It's happening in several different practice models in our country. It's happening in the private fee-for-service model. It's happening in the DSOs, the dental support organizations, the large group practices. We're seeing it, the Dental Trade Alliance, which is our, we see some DTA people here. They're all in on the medical dental integration. So this is the organization that represents the industry of dentistry, okay? And we're seeing it in the public safety net clinics, the FQHCs, the federally qualified health centers. Dental schools have already made this transition. They're teaching our young dentists this. And when they graduate, unfortunately, the mouth gets separated. Remember I said, if we are to be thought leaders, we must provide a thought. One of the things I'm most proud of as president of the American Dental Association was an editorial that we published in the Washington Post the day before President Trump got inaugurated. So this was basically our statement saying, hey, world, we're the American Dental Association. This is who we are. This is what we stand for. This is what we need to do to make America healthy again from an oral health perspective, and this is how we can help. And so I'm very, very proud of this, and if you check the QR code, you can get it, okay? But beyond policy changes and paradigm shifts of dentistry, our capacity in America, we're at 90% capacity. So let's say we get this expanded coverage and we get access to get the other 50% of America to see the dentist. We don't have the capacity to see them. And the only way we can do that is to change, first of all, our practice models, and we have to integrate technology. So I'd like to introduce Dr. Wenyuan Shi to talk about some of the technology advances that we have going with the ADA's Forsyth Institute. So thank you.
Thank you. Well, thanks again for spending lunchtime with us. And big boss have the bigger vision, and so our job is, how to fill in the step 1, 2, 3, 4, and such an honor and for us to be part of the ADA is doing it. So a little bit about myself, and I was really started my career as a scientist, and I spent 25 years at UCLA. I'm both the professor at the medical school and the dental school. But one of the things good about the US West Coast is when you're a professor, investors knocking at your door, and they want to turn your science into technology. So I was involved, set up 4 or 5 startup company, and several of them are publicly traded. One of them are publicly traded. One of those technology we developed are actually on display at the IDS. But nothing more exciting is 8 years ago, I took a job and become the Forsyth Institute and the director who is now part of the ADA. The reason it was exciting is when you're talking about all the exciting discovery in oral health, and Forsyth almost all have a finger in it. And the very first discovery of the fluoride mechanism and related tooth protection, and the first formula who eventually using by the P&G developed the first fluoride toothpaste are actually started Forsyth. And you probably heard every one of us have 2 trillion bacteria in our mouths. There are 700 species of those. Most of those bacteria actually discovered at Forsyth. Many of them named after our Forsyth scientists. And it is the institute and invent the hygienes, and we had the world's first hygiene school, and we developed all the microbiome. So even today, and we're still proud to be the world leading organization and making some of the most important discovery. And for example, we're always talking about oral systemic connection, but you need the real data to supporting it. And some of the things you hear from the mainstream, and such as periodontal diseases related to the Alzheimer's disease, because you can actually detecting gingivitis and all of the periodontal bacteria in the brain, and who are actually damaging a brain cell, That study is actually out of Forsyth. Forsyth was part of it. Recently, you probably heard a oral bacteria called fusobacterium. They actually invade into your macrophage, move around to your body, to your colon. And when you're actually getting a colon metastasis or not is directly determined by this presence of this bacteria. That study is come out of the Forsyth Institute. Now, you remember for a while we're talking about the heart connection with the periodontal disease. American Heart Association initially absolutely hated it. On the left side, they actually had a statement to say it's all bullshit. But now, and 15 years later, they actually now had a new program and call a better smile, a healthy smile, and a healthy heart. And that was because we provide the scientific evidence. And now we work with the AHA and to study the importance of the heart and oral connection. So I do want to say technology will make a difference. In the US, we spend $175 billion a year with 200,000 dentists, some of the best trained dentists, but we only be able to still serve less than 50% of the population. And overnight, we're not going to be able to train another 200,000 dentists to fill the rest of the needs. Technology will be the one making the difference. I'm showing, historically, when you look at the disruptive event in dentistry, and it was all related to the technology. When the European learned how to make the sugar out of sugarcane, and modern human being takes 100 times more sugar than our ancestor, that creates the profession of dentistry. And the fluoride we're talking about, the implant, the clear aligner, CBCT, every one of the new technology is inventing or changing the dentistry. And I'm always excited to come to IDS. I remember 15, 20 years ago, there's the first company showing a 3D printing. They're in one of the little corner, and no one ever goes there. But now you see how many companies are showing the 3D printing. And so it's very exciting how technology will be changing the face of it. And when you look at the next 10 years, people keep saying, and this is going to be the decade for the oral health. And it is truly exciting. You can see for a while, you only be able to get in very limited PE firms, or hardly have any dedicated VC who invested in dental. But now it's totally different. And you probably see the latest news, professional medical VC firms like Obermed, and now they're actually start to invest in dental. And so this is a very exciting time. And so in the background of this exciting time, what the Forsyth as a world-leading oral health research organization, and we did a leap of faith. And we become the first organization left Harvard in its 400-year history. And last year, we become part of the ADA. And it's truly exciting. It's the first time a clinical trade organization team up with a cutting-edge research organization. And in combination, we can do so many things together, which I'm going to quickly share with you some of the things we're doing. And you see them wearing purple, and I just give you one of the trivial here. ADA is green, Forsyth used to be red. Mix them together, happen to be the color of dentistry, and which is purple, which also stands for money. So at the ADA Forsyth, we're very excited developing a lot of new emerging technology. And some of them are actually showcased by some of the company here. And thanks for coming. I do want to share some of the exciting things we're doing. And one of the things is, given all the major investment forum like JP Morgan meetings or bio conference, they all completely ignore the oral health. So ADA decided to creating our own oral health investment forum. And so we're into our 5th year, and our ADA Forsyth DenTech 2025, going to be October this year. And I'm hoping to see many of you there. And we're going to feature some of the most exciting technology because we know and we need to create in the ecosystem, just like a medicine, so we can really nurture those new exciting technology to be successful. And many of you may be a subscriber of JADA. And starting last October, JADA created a new section called Innovation of Excellence. And we are actually, because our members are too busy, and they may not have the time reading Nature Science paper. And we're converting all those new exciting technology into bite-sized one-pager, two-page technology, and updates, and allow them to do more about this. I also want you to highly encourage you attending Reimagine the ADA SmileCon. And in addition to with all the exciting things we're normally talking about, now at the SmileCon, we actually had Innovation Hub. And every year, we're inviting 12 most exciting technology companies, and they're showcase that. And you could actually play around in those stands on some of the new, most exciting technology. And the other things that we all know, ADA have been doing this since 1930s or something under ADA seal. And many of the best consumer products, whether it's mouthwash, toothbrush, actually have an ADA seal. So starting this year, and we're going to be launching an ADA Forsyth certification mark. Because now, with a 500 implant system on the market, and now I have 150, clear aligner, and you're wondering which are the ones works the best, besides the name brand, and there are those other ones needs a lot more clinical testing. So ADA Forsyth is going to step in, and we're creating this certified professional mark, and it will become a trusted mark, and for the consumer and our dentists and to use and to do that. And we welcome many of you actually be our client and getting that certification mark. And I love it's purple. And lastly, I also want to say we're very excited to be here. And even though ADA is a national organization under the leadership of the Brad, and we are doing a lot of global activity, and we actually now create the ADA International. And our head, Marco, is in the audience. And we wanted to really greatly expanding all the ADA standards, the CDT code, our certification mark, and a lot of other knowledge, and transfer that globally. And so we're really look forward and to do a lot more and have the opportunity to work with you all. So with this, I have the QR code here if you want to take a picture. And there's all the information related to what I talk about. If you want to learn more detail, and you can get that from the QR code. And thank you all. And Brad and I are more than happy to entertaining any questions.
Wow, that was awesome. I've never seen so much energy this morning. So a big round of applause for those guys here.
Thank you.
Brad Kessler and Wenyuan Shi. That was awesome. And now, please, seize the opportunity. If you have any questions, raise your hand. I think those two are going to answer it perfectly. So if you want to do that now, don't be shy about that.
While you're thinking of your questions, Dr. Shi and the Forsyth Institute, we made an investment in science. We made an investment in evidence-based technologies because we feel that improving the technologies, will improve patient care, will make it more efficient and more efficacious. And we're the only healthcare organization in the world that has invested in science at the level that we have. So it's something we're very proud of, and it will help, get more patients in our chairs. So.
And we have a stand not very far from here where you can get a lot of additional information about what we do.
So, anyone have any questions?
Yeah, there's a question. You get a microphone. Just please wait.
So we are a startup in Germany, a spin-off from Helmholtz Institute. Very excited and hear that you are also driving the oral and systematic health. So the Helmholtz Institute, we did more than 3,000 cross-body disease samples. We sampling oral, gut, skin, the microbiome samples. We found out actually the oral microbiome has more reliable markers than gut microbiome. My question is, for the global initiatives, whether there is any collaboration possibilities from Germany with Forsyth.
Great question. Thank you.
For sure, First of all, actually, the two of my former students are the deans at the German dental school. So yes, we actually really looking forward to a global collaboration. And I can give you some of the example of how we're going to collaborate together. Beijing University Dental School Dean is here, and we are actually running a lot of the joint research program. Seoul National University, we're actually going to creating a joint research institute, and we even, getting their government funding some of our joint activity. And I actually had a good number of German scientists, work at Forsyth, and they will be a great ambassador and for those kind of interactions. So I'm more than happy to follow up on that.
Yeah, thank you. There was a question over here? No?
See another question over there? No?
Okay.
If not yet, no worries about that. Those guys are also available off stage right now, I think.
Okay.
Because, big round of applause, please, for them.
Thank you.